In terms of the reasons why we set up this project, it was to do with the fact that too many people die each year in Cornwall because of a cold home and because of fuel poverty. We have something like 300 extra winter deaths each year. It's the 5th top reason for people dying early in Cornwall and Isles of Scilly, and it's something we can do something about, so it is preventable.
In Cornwall we have very low income levels, about 22,000 a year compared to the national average of 26,000 a year, so that combined with high number of retirees and an unemployment rate of around 9%, which is higher than the national average of 7%, means there's a lot of poverty in the county, which often goes hidden, unseen.
In Cornwall, the gas network only covers around 50% of the county, and it doesn't quite reach into those much more rural areas. This creates a really high dependency on alternative forms of heating, such as coal, LPG or oil. These fuels can be much more expensive to heat our properties. Oil is 50% more expensive. LPG can cost twice the amount to heat the property. In the Isles of Scilly, there is no mains gas, so all the islanders rely on these much more expensive forms of heating.
When we have an extra winter death, what we know is that there's some 8 warning signs before that happens, so 8 visits by an ambulance, 8 emergency department visits. There can be something also like 2,400 voluntary and community sector visits to a property as well. So there's a lot of costs going on, a lot of work going on to keep people in their homes, but something if we can prevent and actually ensure that they're in a better, warmer home, then they'll actually have better health and then obviously not have to call upon those emergency services.
Well, it just allows patients to avoid hospital admissions because it prevents your general colds, chest infections, exacerbations of asthma, pain in your arthritic patients. If people are in cold, damp houses, they're in and out of hospital, they're in and out of the surgery, they're needing antibiotics. Acute care at home sometimes get involved because they need IV antibiotics because they'll have a really acute onset of it. So if that can be stopped or lessened, it has a knock-on effect to us. You know, our caseload is lightened and the GPs, so it's really beneficial.
I do feel the cold. My husband always says my thermostat's gone wrong, but it's a condition with the liver called primary biliary cirrhosis. I've also got fibromyalgia, which is a painful condition, and the warmth really helps that a lot. We've always had old-fashioned storage heaters, the very old ones, but only 3 in the whole house. The one in the lounge, we had a fan heater, which in the wintertime we needed on most of the time, which made the bills very high. Having contacted Winter Warmth, it was just a godsend to me. From the phone call I made, I was just waiting for some more advice, and then someone came and assessed the property, and then they came and told me where the heaters needed to be, and before long they were put in. Well, it's made our lives very comfortable. No worries about paying for the heating to be put in for a start. It was all paid for us, which was a tremendous help. And we haven't got to worry about feeling the cold any time of the day or night.
So what we try and do through the Winter Wellbeing Project is remove all the barriers that are in place for households to access the services that are available through the entire project. We rely on one free phone number which frontline workers, vulnerable households and carers can utilise. So when somebody was to phone up, they would come through to our free phone number, and the trained energy advisors will then identify the most appropriate solution for you, and we can then provide the support, or we can contact those different organisations on behalf of the vulnerable client.
One simple intervention could actually lead to a whole succession of follow-ons. So we can provide emergency support such as electric heaters, coal, key meter top-ups, boiler repairs and so on. But everyone that has emergency support, we've said it's conditional on having a home visit, because in the long run we want to get to the root of the problem and try and make sure they're not in that position anymore.
So I had somebody else come down very gratefully to give me some money and also to feed the key meter. She actually gave us £45 in cash and put £200 on the key meter, which was like winning the lottery, because I still kept putting the money on the key meter, but I was building up for, you know, where one week if we were a bit short of money, I didn't have to put that £40 on the key meter. So yeah, brilliant. Another concern I had was I wanted to come off the key meter, but I had to find £150 to come off of it. We're not in a position to find £150 just like that. Amy was sitting, we was chatting, and she just got on the phone and told them my condition with emphysema, that I couldn't always get down to feed the meter, the key. So within about 3 weeks, we'd got a proper meter and a bill. And instead of paying £40 a week, we're now paying £30 a week. Big difference, big difference.
The programme's worked really effectively this year, so we've helped over 2,200 households through the project. Around 390 of those households have been able to access support from more than one organisation.
So the message to frontline workers is, if you've got a client that needs some sort of support, you don't have to know who can provide it. You don't even have to know what sort of support it is they need. Just call our free phone number and they'll diagnose the needs, and they'll farm them out to whoever they may need help from. So it may be they get insulation from Community Energy Plus, they may get a benefit check from Citizens Advice Bureau, they may get hot meals from RVS, and so on. So it does mean we've got a huge range, and we're trying hard to make sure we get access to all the clients out there and all the little nooks and crannies, that they get the support they need.
The main reasons behind the project are to tackle 3 issues. It's reducing fuel poverty, improving health, and progress into work. So by that, what we're looking about is how do we make homes more insulated so people enjoy their home more? How do we improve their health as a byproduct of that? And once we've tackled the issue that prevents them doing many things in their life, then they can focus on what they can do. And we work with our partners in Inclusion Cornwall to start them on that journey of progressing back to work.
When you've got money worries, it's like a slippery slope, and you go down and down and down, and the handrail gets more slippery to try and get up again. They gave us that lift up to get on an even level, so we can stay on an even level.
What I'd like to highlight with Winter Wellness is the fact it's been a really great project to work on. The reason being for that is we've brought together some 30 partners with a common aim of tackling reducing winter deaths and reducing fuel poverty. But it's the longer term outcomes is what we're looking for, and that's been some of the greatest pleasures we've got, that you start people on that journey of moving away from what they can't do to what they can do.
My experience of working on the project it's been one of the most enjoyable things I've ever done. It really is satisfying to feel like you're making a big difference to the lives of individuals, and those that are most vulnerable as well. And let's face it, you're working with people who care and really, you know, they really want to help these people. So it's rewarding, and you just feel waves of goodwill from all the partners who all want to make it work. It's been fantastic.